Dr. Colleen Fogarty, the chair for the University of Rochester Department of Family Medicine, is with us. Doctor, good morning.
Good morning.
I want to talk about the health benefits of a couple of programs here that have been especially beneficial during the COVID pandemic. The first is the Earned Income Tax Credit. So let's begin by explaining this tax credit and the health benefit for families, Doctor.
Yes, so the Earned Income Tax Credit can give families a refund at tax time or lower the amount of taxes owed. And there's a really important benefit here for particularly the children in these families, is that there's access to some more resources. So if a parent needs to get a child a certain kind of thing for their school or some other resource that will help the child's growth and development, it's an important availability. In healthcare, we know that there are social determinants of health, and for families who don't have enough money, that can be a big deterrent for getting into the doctor or doing other activities that promote health. So the amount here is worth up to $6,600 depending on the family size and depending on the family's income and marriage status.
You know, and we talk about this tax credit with our CPAs from time to time. I also think about the health benefits in terms of diet for families as well, making sure that you're getting the right foods, healthy foods, right? Absolutely.
That's right. These dollars can be spent on local or fresh produce or other kinds of activities, perhaps the dues for a small sports team or other kinds of things like that the family might not ordinarily be able to do.
Great insight there. I want to ask you about this other program I mentioned off the top. It's the effort to make broadband more accessible for families. Why is this important from a health standpoint?
Absolutely. So for children in this pandemic era who needed to be on Zoom for school, we know that children's main job, if you will, is to grow, develop, and learn. And our education systems allow children to learn and to develop. So for families who had poor access to broadband or no access, those kids were left really hanging without an educational opportunity. So that's one benefit. The other benefit is the availability of information these days, as you know, is very dependent on the internet. And so someone who has access to looking up some medical information, some health information, or actually getting on the patient portal and accessing their own healthcare team, looking up their own labs. A parent who suddenly needs vaccine records for something that's due at school can log on to their children's health record and print out their immunization record. So again, broadband really allows people to learn, grow, and thrive in the healthcare area as well.
And that last point is one that I think is overlooked by a lot of people, Doctor. Efforts afoot both federally and on the state level and locally as well to bridge this digital divide. Let's leave it there. Our time is short, but as always, we thank you for your insight on these health benefits for our viewers.
Thank you.
If you missed any of our conversation, we'll have it online as well at rochesterfirst.com.